So here is the presentation or lecture on this medium of Ayurveda network 𝐵HU. The title is Immune Mechanism and Ayurveda. There will be 4 of this. This is the part 1, which is titled as Overview of Immune Mechanism. As we all are aware, all of a sudden one virus has came and there is a health emergency, there is an economic emergency across the globe, and immunity has all of a sudden become a watchword. And everybody is speaking about immunity, and even Ayurvedic fraternity is asked whether your science has got concept of immunity or not. And that is why it is really very important for Ayurvedic fraternity to review the mechanism of Ayurveda. I am saying mechanism while putting this title, immune mechanism. I was very meticulous because system is somewhat static kind of thing, and the immune mechanism is indeed a mechanism which is very much dynamic, as you will come to know in these presentations, the series of presentations. So it is really needed, it is a need of hour for Ayurvedic physicians to understand this. It is needed because when our fraternity is asked what is the concept of immunity in your science, the first answer from our fraternity comes, yes, we have the concept of 𝘉𝑦𝑒𝑑𝑥𝑚𝑎𝑡𝑣, and that it is. Or whenever we Ayurvedic physicians are treating or somewhat hypothesizing, or we are writing something, so everybody is speaking about cytokine storm. And when asked what is about immunity, then everybody is speaking, yes, 𝘉𝑦𝑒𝑑𝑥𝑚𝑎𝑡𝑣, it is there, ho gaya. And that is where we often fall to the fallacies. There are fallacies. One is called a single cause fallacy. Another is casual oversimplification. So we should not fall prey, because it is said that God and devil both comes in detail. So we really need to go through details of them, and we just cannot oversimplify. We just cannot equate that, yes, immunity, 𝘉𝑦𝑒𝑑𝑥𝑚𝑎𝑡𝑣, that's it. One reference is there, somewhat 𝐶𝐾𝐪𝑝ani has said in Charak Sutra Sthan 28, and that's it. That would not be the way. Such a casual oversimplification is not going to work. We need to go thoroughly. Ayurvedic fraternity need to go thoroughly, and that is why, being a faculty of Ayurveda physiology, this is just an attempt to compile few things and put in front of you. Charaka has very rightly quoted in the end of Nidana Sthana that there are multiple causative factors for multiple effects, and the single causative factor can lead to multiple effects, whereas a single effect can be generated from multiple factors. So this is really needed to be understood when we speak about immunity, because it is really a very dynamic mechanism. It has got so many factors. There is an interplay of so many things. So this should be our perspective. We just can't say that this thing is the cause and this is the effect. There is an interplay of so many things. And without understanding all of them, when we are making just one, some blunt kind of claim that our medicine is going to enhance immunity, it is obvious that we will be faced by some kind of criticism. Because there is always a crisis of epistemology in our field. There is a crisis of terminology in our field. So it is, on one way, it can be fine if we had said that our medicine is going to enhance Vyadhi Pratikarak Kshamatva. That is one way, that is fine. But the moment we use immunity, we must be very clear what immunity is, what its Ayurvedic translation can be, and what our medicines are going to do with immunity, whether it will be humoral, whether it will be C-mediated, whether our medicines are going to work on memory, immunological memory, or what kind of, by immunity, what do we mean exactly? That is what we need to put. And without putting it in that way, this is the criticism. There is one more. This is from Alter News. And there was one more printed in last week in social media, Print Health. So they have again criticized that there are some patients who have consumed excess of 𝑓 and there are so many, somebody has consumed excess of curcuma longa, that is haldi or rajini, and there are adverse effects. Modern physicians were very prompt to report them, and such a kind of criticism can be there, and that is why we need to be careful while saying that what is enhance immunity, what that enhancing is. There is nothing like that enhancing. There is nothing like that boosting. So what it is? So far as the context of COVID is concerned, this is a figure from Frontiers in Immunology, printed, published latest. So this is very simplest kind of good figure. This is, you can just see there is exposure of SARS-CoV-2, infection, no infection, symptomatic, asymptomatic, mild, moderate, severe, and others get recovered, and severe has finally concluded in a bad prognosis and landed up in death. So what this is? The green colored and the red colored part, what they have shown, is nothing but immunity only. The protective immunity is again the immunity only. The role is neutralizing antibodies. The role is cytotoxic CD8 cells. It is called as Th1 response. Whereas what ARDS is, acute respiratory distress syndrome. The complication of COVID, what it comes from? It comes from lung injury. What that comes from cytokine storm and acute inflammation. So the inflammation is needed as a part and parcel of immune response. But the excess response, exaggerated immune response, is what leading patients to the bad prognosis. So it is the immune mechanism only that is responsible for good outcome, as well as that is responsible for bad outcome. We must be very careful about saying that our medicine is going to enhance immunity. So what kind of immunity our medicine is going to enhance? This is the all interplay we need to understand. And I'm here to simply put few facts, simply compile few things and make the 3 or 4 presentations. And perhaps if this is the way that early phase and severe phase are different, so our way can be, perhaps, I'm not concluding, this is not something concluding statement, but whether if it is so, it is needed to be checked that earlier phase is Vata Kapha dominant, whereas the latter phase is Vata Pitta dominant, because Dhatu Paka in inflammation and multiple organs, once the cytokine storm is there is inflammation and even decay of body tissues. This inflammation is seen affected in vital organs, and that is why patient turns in MODS, multiple organ dysfunction syndrome. So this indicates somewhat phenomenon what we call in Ayurveda as Dhatu Paka. So perhaps the phase of infection, the earlier phase is Vata Kapha dominant, whereas latter phase is Vata Pitta dominant. This is what basic research we need to do, and then only we need to propose something, and then we need to prove something. So for that, the foundational stone will be to understand concept of immunity from modern physiology and to make Ayurvedic comments on it. And this presentation is that. So this is the first part of it, overview of immune mechanism. I am Dr. Prasad Pandkar. I am Associate Professor of Ayurvedic Physiology at Bharati Vidyapeeth's College of Ayurveda, and I am Ayurvedic physician in Pune, and I am a R&D consultant from 𝑉𝐸𝑚 Ayurvedic Research Center that is based in Kolhapur, Maharashtra. So this is the overview. Immune mechanism overview in one figure. The pathogen, it has came. First of all, it is faced by natural barriers. Then it will contact with immune mechanism. There will be immune response or there will be no immune response, because tolerance can be there. In Ayurveda, we have the concept of Satmya. The concept of Satmya is very important because it is not necessary every time immune response will be given. The response can be specific and non-specific, as we all know. The non-specific is innate immunity, whereas this is adaptive immunity. The innate immunity will lead to phagocytosis and inflammatory response, whereas adaptive will lead to humoral and cell-mediated. The fate of innate immunity will lead to either pathogen will be eliminated or chronic inflammation can be there. Whereas specific immunity, adaptive immunity, that will lead to the pathogen elimination, immune memory, and immune pathology. So that is what the overview is. Let us see the brief history of immune responses. Thucydides in Greek medicine, in the history of Greek medicine, he had observed in BC 430 that same man was never attacked twice, not at least fatally. So this is the pinpoint observation seen in Greek medicine, whereas in Ayurveda we have the concept of satmya, but there is no such a kind of statement as such, as far as I have been tried to compile the things and search the things. Rhesus was there. He had explained that immunity is expulsion of excess moisture. So that was his. Then comes the Louis Pasteur, father of immunology. He is considered father of immunology. However, the first vaccine was made by Edward Jenner, the British fellow, in 1798 only. But still, in spite of that, the father is considered to be Louis Pasteur. We are aware about his work. 𝐿𝐴 was a Russian zoologist. He is considered to be father of natural immunity. We know about him for his aging theories. And then came the Nobel Prize. There are so many Nobel Prizes in the field of immunology. For 𝐿𝐴 and Paul Ehrlich, that was for cellular and humoral immunology. Lymphocyte recruitment and inflammation. These three important things were first of all put forth by this duo. Then was this German fellow who put these three layers, the skin, innate and acquired. Then come the theory of adaptive enzymes, and later in the 1984 came the theory of antibody formation. And lastly, this is the latest happening, we can say, in 1994. This was the first publication, and the last publication of this series came in 2000. That is by Matzinger. And what she proposed a danger theory. Until 1994, it was believed that whole immune mechanism is all about self and non-self, distinguishing self and non-self. Now what is self is again a very detailed thing. Few scientists believe that everything that is encoded with your genome itself. Few say that everything under your skin can be regarded as self. So whatever, that is again the detailed thing, let us not go into it. But until 2000, it was believed that whole mechanism, 1994, it was believed that whole immune mechanism is dependent on recognition of self and non-self, whereas Matzinger came up with a proposal that it's not self and non-self, but it's a danger and non-danger. So it is in her words that immune system does not care about self and non-self, that its primary driving force is need to detect and protect against danger. And this immune mechanism receives communication from extended network of other bodily tissues. So these are her very important remarks. These are the basic, brief, very brief immunity. This is anatomy. We all are aware that lymph nodes, thymus, bone marrow, spleen, even liver is there, and adenoids and tonsils. Bone marrow is the site for blood cell production, we all are aware. Thymus is the place where lymphocytes get matured. Lymph nodes is the place where they actually circulate and they are returned to the systemic circulation via thoracic duct. Then there is spleen, whose function is antigen presentation to mature lymphocytes, and reticular endothelial system and removing debris and old cells, we all are aware. And then liver has got functions, that site of antigen presentation. It has its own cohort of phagocytes and lymphocytes. and liver is able to synthesize some proteins involved in immune mechanism. That is the basic anatomy. Physical and chemical barriers, the first line of defense. There is epithelial barriers, there are longitudinal flow of air and fluid, because it's not only skin there, but there is a flow, longitudinal flow of either air or fluid. There is continuous movement of mucus by cilia, discomatation of skin, natural acids are there, and normal bacterial flora. So in the innate immune response, this comes first: physical barrier, epithelium, GIT, RT, body hairs and cilia. Just as in the last slide we saw, the secretions, saliva, mucus, bile, gastric acid, sweat and tears. This is the chemical barrier. And then comes the innate immunity, non-specific response, that is inflammation and complement that involves membrane attack complex, chemotaxis, cell lysis. Primarily cells involved in this innate immune response are neutrophils, basophils and mast cells when in tissues, whereas when in the circulating blood, more of it about neutrophils, and dendritic cells and NK cells. NK cells are natural killer cells. And dendritic cells, they are again very important. Innate immune response. Adaptive immune response, this comes later. The first line of defense is innate immune response, that is non-specific. After that comes in the role that is adaptive immune response. It has got B cells and T cells. B cells mature in bone marrow, that is humoral immunity, whereas T cells, they mature in thymus and they express T receptors. There are CD4, CD8, and that is cell-mediated immunity. Another important part in adaptive immune mechanism is MHC, major histocompatibility complex. And as we all are aware, CD4, CD8 were the watchwords in the HIV area, HIV era. So CD4, CD8, that is what we do ratio and everything in our clinical practice. So this is the differentiation of T cells only. This is the difference between innate and adaptive immune mechanism. This is non-specific, this is specific. That is the first difference. Innate involves leukocytes, whereas adaptive immune response involves B cells and T cells. Innate is immediate, whereas adaptive needs some lag time. Innate is a cell-mediated humoral. This has again the similar components. Most important difference is innate immune response being non-specific, there is no immunological memory. Whereas adaptive immune mechanism has got immunological memory. Once you get infected, your B cells, plasma B cells, then a part of B cells get converted into memory cells. Even T cells, even the fate of T cells, few T cells get converted into memory T cells. And these memory cells, they have got huge, very long life. They can live up to a few decades. And they keep the memory and they are able to produce antibodies if the similar antigen is presented to them. And this forms the basis of immunity. That's why this is important. This forms the basis for the vaccine immunity. And the last one is adaptive immune response is only in jawed vertebrates, whereas innate immune response, the non-specific, is there in almost all kind of forms of life. And what adaptive immune mechanism is further divided into, it's cell-mediated and humoral. So what is the basic difference? The cell-mediated and humoral, the basic difference is one is going to kill your whole cell, whereas another is going to kill only antigen. That is the basic difference. Let us just overview this. The cell-mediated is about B cells, whereas humoral is more about T cells. Cell-mediated produces antibodies, whereas humoral is more about cytokine secretion. And humoral has got T lymphocytes, helper T cells, natural killer cells, and macrophages, because this is a cytotoxic action. They are going to kill the whole cell. So humoral cells mechanism is identifying the virus and microorganism and go for cytotoxic action for intracellular pathogens. Whereas B lymphocytes are involved in this cell-mediated immunity where they secrete antibodies, and the antibodies recognize the antigen-producing antigens and then they kill that extracellular pathogen. And that is why the cell-mediated component is there in early stage of graft rejections, whereas the T cell and this humoral immunity is needed to be cared while organ transplantations. So this is the basic difference. We have all seen this in our UG and G things. We are just here for an overview. This is again, these are the cells from pluripotent stem cell. We all know this thing. On one side you get adaptive immunity cells. So what are they? They are B cells, T cells. So they are coming from lymphoid progenitor. So B cells, what is fate of B cells? They will be either converted into plasma cells. Those will actually make antibodies, whereas rest of the B cells will be converted into memory cells. And as the same lymphoid progenitor is going to make T cells, they will be further divided into helper and killer, that is CD4 and CD8. The same lymphoid progenitor is going to make NK cells, that is natural killer cells, and dendritic cells. So they are part of, although innate immunity, but they come from lymphoid progenitor. Then the myeloid progenitor, that is going to make RBCs, and this is the classification we all know, monocyte. Monocyte can further lead to macrophage or dendritic cells, and eosinophil, basophil, and neutrophils. That is, cells in immunity are generated. Now this is the slide about how these cells get stimulated and what is the chronology. So first of all, there is a role of antigen presenting cells. They are going to activate the helper T cells, that is CD4, and that will be further, the fate of this activation is they will activate to B cells. B cells will be converted into plasma cells, further into antibodies, and rest will be stored as memory B cells. In a similar way, cytotoxic T cells, they will lead to their action of cytotoxicity, the pathogen they will kill, as well as the cytotoxic T cell mechanism will also lead to production of few memory T cells. So that is how it works. This is important. Th1 and Th2 theory. The T cells, which are the part and parcel of adaptive immune mechanism, they are further divided into CD4 and CD8. CD4 are the helper cells, and CD4 cells and even their cytokines, they are broadly classified into two groups. One group is Th1 and another group is Th2. And both of these groups, they have a balancing kind of action. So what it is, I've seen in this slide, the Th1 response comes first. As soon as the infection is there, first response comes the Th1 response. Its role is to kill cells. On this side you can see, its role is to kill cells, and this is mainly macrophage mediated. The Th1 response is inhibited by cytokines released by Th2, whereas the Th2 response is again inhibited by interferon gamma, which is secreted by Th1, because they both are balancing each other. They are both are complementary with each other, and the basic difference between them is Th1 is pro-inflammatory, whereas Th2 is anti-inflammatory. As we had started at the outset, we took that example of COVID and how the inflammation is needed as an innate immune response. In the first part of it, you need Th1 response, you need inflammation, but you need not, your inflammatory response need not to be exaggerated. That's why the Th2 part comes into play, and that part is anti-inflammatory part. So what is Th2 part? This comes later. They do not kill cells, They recruit the eosinophils, they help B cells, they help IgE, and they secrete these cytokines which are anti-inflammatory. So this balance is the crux of whole thing. We all really need to understand this when we are speaking about immunity these days. So Th1, that is going to stimulate cytotoxic T cells, and this Th1 is important in autoimmune disorders, the specific autoimmune disorders, whereas Th2 is there in autoimmune disorders which are systemic. Th1, as I was just a few minutes before saying, it is seen in acute infections. What Th2 is all about? Th2 is all about pregnancy, because pregnancy is a Th2 dominated thing, because you need to maintain that fetus. You need to have the action that is anti-miscarriage action. So that anti-miscarriage action is indeed the Th2 one. Or chronic allergic responses, they are the Th2 responses. In parasitic infections, you see the Th2 patients, whether the naturally delivered baby, how he or she is having immune responses, and how the immunity of that LSCS, the cesarean section born babies is. So why the difference is? That difference is because when the baby is delivered through the reproductive tract, which is full of microbiomes, that exposure is there, and the Th2, the baby is coming from Th2 dominant phase. So the Th1 gets ignited, and that's why the babies, those are normally delivered, they have better innate immunity. That is what so many people are putting. The reason lies in this Th1 Th2 theory. Even this point 3, that elderly people population in developed countries, in COVID-19, we have seen that in Italy, in Spain, in United States of America, there was so many fatalities. The mortality rate was quite high. It is simply because the less exposure to the infective antigens, and that is why this leads to Th1 reduction. Th1 reduction is there. Even as the last point said, COVID-19 has affected those countries, those are having robust and free influenza vaccination programs. We see the culture in the United States of America. They get flu shots every season. Flu shots. What these flu shots are? They have the vaccination for all the influenza and variety of viruses. So that's why the immunity, the Th1 response is there less. And there are so many things, there are so many publications, whether even those flu shots, even the mucosal or intramuscular, which kind of shot is going to have different kind of immunity protection, the things are going to differ. So the Th1, Th2 theory has got so many applications. This one point, the second last, malnutrition, overcrowding, and vitamin D deficiency. So such a factors, they lead to induced Th2, and in turn they downregulate the Th1. So this is a huge complex, the Th1, Th2 and their balancing action with each other is a very big complex. And if we have to speak about that Ayurveda medicine is going to work on immunity, it is really a big challenge. We need to work, whether we need to put it like whether what kind of Th1 or T kind of thing our medicine is going to work upon. So T effector cells and T regulatory cells, that is the another term. So T regulatory cells, they play a role in maintaining immune homeostasis. Immune homeostasis is the word, because immune mechanism and inflammation, that is just the first phase. The second phase comes anti-inflammatory itself. That's why there are these the T-F and T-reg, that is T effector cells and T regulatory cells, and then there is balance between these two. And that's why this balance is needed for immune homeostasis. This balance is needed, and once this balance goes on, then this lands up in autoimmunity and so many other pathological kind of phenomena. The another important part in immune mechanism is immunoglobulins. We all know IgG, IgM, IgA, IgD and IgE. All antibodies are immunoglobulins essentially, but all immunoglobulins are not antibodies. From where they come, this is all about. IgA you can see in your saliva, in your GIT. So this is just an overview. IgG, it can cross placenta, it can give the long-term protection, the protection against bacteria, viruses, neutralizes the bacterial toxins. What is IgA all about? IgA is all about, it is there in your saliva. So IgA is all about binding the antigens on microbe before it invades the tissue. That's why it is there in whole your GIT. Because when the antigen has come, something pathogenic element has entered our body, before it gets to binded somewhere, it needs to be spilled out. And that is why IgA is there in your saliva and the whole GIT. So its role is to aggregate the antigens and keep them in secretions only, so that when the secretion is expelled, so is the antigen expelled. And that is why this is the first line of defense in mucosal surfaces such as intestines or nose or lungs. And IgM is all about ABO blood group antigens and the surface of RBC. That is for enhancing engagement of cells by phagocytosis. IgE is about mast cells and basophils. Some believe that it is for parasites. IgD, it has got a role in induction of antibody production. The basic overview of functions of antibodies is neutralization, that they prevent pathogen from entering only. Opsonization, that stimulate the removal of pathogen by NK cells and macrophage. And lastly, triggering the destruction of pathogen by stimulating other complementary ways. And this is the last thing, cytokine. In immune mechanism, cyto, the word cell, stands for cell, and kine, the word stands for movement. They are the cell signaling molecules, as we all have reviewed these days. What are cytokines? We all know that they are responsible for the communication between two cells, particularly in case of infection, trauma, inflammation, and immune mechanism. They are essentially peptides, proteins, and glycoproteins. So in the coming lectures, when we will see about macronutrients and micronutrients, how proteins are important for our mechanism, immune mechanism, this will be there, that all cytokines are proteins only. So that's why we say that protein energy malnutrition is associated with deprived immune responses. So that we will be seeing in later parts. So they are essentially proteins. Why they are not hormones? This is somewhat theoretical, because classically proteins circulate in nanomolar concentrations, whereas cytokines, they can circulate in picomolar one. So basically they are the immunomodulating agents, they are the messengers. What are they? They are lymphokines. The one comes from lymphocytes. Interleukins are the very famous. Then the one they are also called as chemokines. The one comes from monocytes are called as monokines. What are commonly known? Commonly known are chemokines, interferons, interleukins, IL-1, IL-6, IL-10. IL-6, there are so many hospitals where the COVID-19 patients, they are examining IL-6 because that is very famous and very established marker. And TNF, tick tuber necrosis factor. Immunological memory, this is the last part in the basics of immunity. So this forms the basis of vaccination, as we were few minutes before talking about it. T cells and B cells, both after killing the pathogen through antibodies or through directly killing the cytotoxic action, some of the T cells or B cells, they get converted into memory cells, and they can last for years together, decades together, and they form the immunological memory, which forms the basis for vaccination. However, in few cases like dengue, the another presentation can be more fatal. So the dengue is the exception for them. But this is the routine thing that most of the times antigen once presented to adaptive mechanism, few T or B cells, they lead to memory. So what this immune mechanism can land up into, which kind of pathophysiology this is going to land up? There are 4 possibilities. One is primary immune deficiency. One can born with weak immune system. Another is acquired immune deficiency. One can get diseased, the HIV, and not only HIV but even systemic diseases. They can weaken your immune mechanism. Allergic reactions, this is a hyperactive immune response, and autoimmune disease is your immune mechanism against you only, against the host only. So these are the 4 things. So this was all about basic of immune physiology. Now the question comes how to interpret it in Ayurvedic physiology or how to interpret in Ayurveda. So what it all about was, what were the things those were involved? There were blood cells, there were lymphatics, there was liver and spleen, bone marrow, thymus, and immunological memory. So what are we going to do? How we are going to translate and how they can be Ayurvedic complements what there can be. Now coming to the classical Ayurvedic perspective, forget the Sharir Bhavas, forget the anatomy of immunity, modern anatomy of immunity. Let us simply try to understand what immunity is all about. Immune mechanism is all about. It is all about the defense. And why defense? Why defense? The answer is to maintain the 𝑘𝐸𝐴, to maintain the homeostasis. So what are the Ayurvedic, classical Ayurvedic things or classical Ayurvedic captions? Those need to be understood as immunity. The very first comes is 𝑉𝑦𝑎ධિ-ક્ષમત્વ. This simply comes because 𝑉𝑦َધિ-ક્ષમત્વ is the direct, somewhat that can be equated with modern concept of immunity. So 𝑉𝑦َધિ-ક્ષમત્વ is what comes as the first thing. Second is Bala. The concept of Bala is very well analogous with the concept of immunity, and that is why Balavardhak Rasayanas are there, and there is a plethora of publications on how Rasayana, herbs and Rasayana formulations are immunomodulatory. And the last thing is Ojas or Soma or Kapha, because Charka has said Prakrutisto Balam Shleshma, whereas Sushruta has equated Bala with Ojas. So these are the classical Ayurvedic notions which equate with immunity. And here is the last slide that, so to conclude, what are the bhavas those are involved with Bala? So far as concept of Bala is concerned, the first Sharir Bhava comes into mind is Vayu, because Charka had started Vatvedi Chikitsa with the verse Vayur Ayu Vayur Balam Vayur Dhata Shiriranam Vayur Vishwamidam Sarvam Prabhur Vayushya Kirtitaha. So Charkacharya is saying Vayur Ayu Vayur Balam. So Bala is equated with Vayu here. And which kind of Vayu it is? It is Udan. Udan is very beautiful kind of Vayu. It's all the functions are expression is main function of Udan. Expression of Avyakta to Vyakta. Because it is about Smriti, it is about Bala, it is about Varna. All these things. They are, so Bala is dependent. Bala is equated with Udana in few classics. So Udana is equated with Bala. So that is the first Sharir Bhava. Kapha, because the Bala is depend upon all those Kapha gunas, those Snigdha guna, Shita guna, Manda guna, Guru guna. They are going to make that foundation. Whereas Sushruta is very apt. He has not said that Kapha, he has not equated Kapha with Bala, but he has equated Ojas. And Ojas will be the product only and only if your Agni and Dhatwagnis are working properly. So that is why here Sushruta is a little bit 1% more beautiful to equate Ojas with Bala and not the difference between these two classics. So is this only? Is this the Ayurvedic concept of, is this the Ayurvedic translation of immunity, and is this all about? So is not the case. Immunity is a huge complex. This was the first presentation where we understood about the overview of immune mechanism. We gone through the history, anatomy and physiology of immune system. We understood the innate and adaptive immune response, and we tried to understand the Ayurvedic perspective of these. In second part, we will be simply compiling or reviewing, whatever you may say, the systemic interactions of immune physiology and Ayurveda. How this immune mechanism is associated with another body systems. So we will try to understand inflammation, immunometabolism, the interface between immunity and metabolism, how neuroimmune relations are, how the gut-brain immune axis is, what is PNI or PNEI, psycho, neuro, endocrino, immunology, why modern scientists needed to put them all together, the behavioral immune mechanism, the term sickness behavior. So this is how immune physiology is associated with rest of the body systems, and what can be Ayurvedic interpretation on it, we will see in part 2. In part 3, we will try to understand immune responses and variables, how they are going to vary according to environment, nutrition, age, macronutrients, micronutrients, both of them, age, exercise, and what is basic immune pathology, and how we need to understand it with Ayurveda. We will make few comments, and the last presentation will deal about immunomodulatory efficacy of Ayurveda herbs, their translational value, and at the end, conflict of epistemology. So what is immune homeostasis, which drugs are immunostimulants, what are immunosuppressants, and what to interpret all these in Ayurveda, we will see in the last part of it.